Today we'll dive into 10 exercises that could raise your stroke risk, especially as you age. But first, let's talk about how exercise benefits your heart health. The American Heart Association recommends at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity activity each week. Exercise helps combat cardiovascular disease, high blood pressure, and diabetes. It lowers cholesterol, improves mental health, and boosts energy. However, our cardiovascular system becomes more fragile as we age. Arteries stiffen, blood pressure regulation becomes more sensitive, and the heart muscle weakens. Older adults, particularly those over 60, might not be able to handle intense exercise without negative effects. Their bodies might respond to physical strain by spiking blood pressure or dramatically changing heart rates, which could trigger a stroke. Now, here are 10 exercises that can be risky for certain older adults, especially if done intensely or with underlying health issues. We'll also discuss alternatives to help you stay fit safely. 1. Heavy weight lifting, especially overhead or isometric lifts. According to Dr. Thomas Allison from the Mayo Clinic, heavy lifting, especially overhead, can drastically spike blood pressure to dangerous levels, reaching 300-200 mmHg or higher. Isometric or static lifts like planks put immense strain on arteries as well. Moreover, holding your breath during heavy lifts, known as the Valsalva maneuver, can further increase cerebral artery strain, potentially leading to hemorrhage or an ischemic stroke. An intense rise in blood pressure or a sudden drop due to improper breathing techniques can also increase the risk of blood clots or ruptures in fragile blood vessels, especially in older adults. Safer alternative: instead of heavy weight, focus on moderate resistance training with proper breathing, exhale on lifting, inhale on lowering, and controlled movements. Aim for 2 to 3 sessions per week, targeting all major muscle groups for 30 minutes. 2. Burpees. Burpees involve rapid posture changes from plank to squat to jump, putting immense cardiovascular strain on the body. These high-intensity moves can cause blood pressure drops or heart rate spikes, both of which can disrupt normal blood flow to the brain. One study published in Neurology International reported a 46-year-old with no prior stroke history who experienced a transient ischemic attack or mini-stroke after doing burpees. Upon investigation, it was discovered that the patient had narrowed arteries, likely contributing to the stroke. Safer alternative: opt for low-impact cardio like slow step-ups, marching in place, arm and leg raises while seated. These activities elevate your heart rate gently without abrupt movements that could risk blood flow. 3. Hot yoga or high-temperature workouts. Exercising in high temperatures like hot yoga can lead to dehydration, lower blood pressure, and thicker blood, increasing the risk of blood clots or reduced blood flow to the brain. A study from Harvard Medical School published in 2018 highlighted that older adults experience greater cardiovascular strain during high-temperature workouts than younger individuals. The increased strain leads to heightened blood viscosity, raising the risk of ischemic stroke. Safer alternative: practice room temperature or chair yoga for flexibility and balance. There are various online resources offering chair yoga routines suitable for different needs and abilities. 4. Box jumps or plyometric jumps. Box jumps and plyometric jumps involve explosive movements that can cause sudden surges in intracranial pressure, especially when performed intensely. According to a study in the European Journal of Preventive Cardiology, adults over 60 years old performing box jumps experience systolic blood pressure spikes up to 260 mmHg. Such substantial increases can risk rupturing cerebral arteries, particularly in older adults with existing vascular issues. Safer alternative: choose lower impact exercises like step-ups, toe raises, or controlled agility drills such as side-stepping. Gradually build up intensity and ensure proper technique to minimize cardiovascular strain. 5. Long-distance running, unmonitored. While running is excellent for cardiovascular health, long-distance running, especially without monitoring, can pose risks, particularly for older adults. Prolonged high-intensity running can lead to arrhythmias or atrial fibrillation, increasing the risk of embolic stroke. A study in Mayo Clinic Proceedings in 2019 found that endurance running in older adults is associated with arterial stiffness and atrial fibrillation, both risk factors for stroke. Safer alternative, opt for brisk walking, interval jogging with walking breaks, or swimming. These activities elevate your heart rate without the same intense cardiovascular strain as long-distance running. Number 6. Leg press machine, heavyweight. Using the leg press machine with heavy weights can be beneficial for lower body strength. However, if done intensely or with poor breathing, it might pose risks. According to a study in the Journal of Human Hypertension, heavy leg presses can spike blood pressure to dangerous levels, reaching 300-200 mmHg or higher. This strain, especially when combined with holding your breath or the Valsalva maneuver, can increase the risk of blood clots or ruptures in fragile blood vessels, particularly in older adults. Older adults might not be able to tolerate the extreme strain of heavy weightlifting without negative consequences. Safer alternative, use resistance bands or perform bodyweight squats with proper breathing, exhaling on exertion and inhaling on relaxation. These exercises offer similar benefits with less cardiovascular strain. Number 7. Rapid twisting of workouts. G. Russian twists. Rapid twisting of workouts, such as Russian twists, can exert considerable strain on the vertebral arteries located in the neck. These arteries supply blood to the brain, and any reduction in blood flow can temporarily deprive the brain of oxygen, leading to ischemia or what's commonly known as brain fog. A study published in the Spine Journal in 2021 reported a case of a 72-year-old with cervical arthritis where rapid spinal rotation led to temporary ischemia. Another study noted that individuals over 60 with narrowed vertebral arteries were more susceptible to mini-strokes during intense twisting exercises. Safer alternative, opt for slow, controlled core exercises like dead bugs, bird dogs, or seated marches instead. These exercises engage abdominal muscles without the rapid twisting motions that could compromise blood flow to the brain. No. 8. Transitioning from downward dog to headstand in yoga. Inversions like the headstand increase intracranial pressure and restrict blood flow from the brain via the jugular veins. This can lead to reduced blood flow to the brain and a subsequent increase in the risk of mini-strokes or transient ischemic attacks, especially in older adults. A review of literature published in the Journal of Bodywork and Movement Therapies in 2017 suggests that these inversions can be challenging for individuals with carotid artery disease or other circulatory issues, potentially causing lightheadedness or even fainting. Safer alternative, practice wall-supported yoga, headstand variations, or gentle floor stretches and balance poses. These alternatives help maintain balance and strengthen the core without the intense cardiovascular or cerebrovascular demands of fast transitions. No. 9. Extreme breath-holding practices, e.g., Wim Hof method. The Wim Hof method involves hyperventilation followed by breath holding. While the practice has its benefits, extreme breath holding can reduce blood flow to the brain by restricting oxygen intake, a condition known as hypoxia. This can lead to cerebral vasoconstriction and, in severe cases, trigger transient global amnesia, a temporary inability to remember recent events. A case report in Frontiers in Neurology in 2022 described a 63-year-old who experienced transient global amnesia and microstroke symptoms after intense breath-holding practices. Safer alternative, engage in gentle diaphragmatic breathing or the 4-7-8 breathing technique. These practices promote relaxation without the extreme physiological stress of extreme breath holding. Number 10. Straining on the toilet. Chronic constipation and the act of straining on the toilet can mimic the Valsalva maneuver, which involves holding your breath during heavy lifting. Straining can suddenly spike intracranial pressure, posing risks for older adults with vascular disease. Drive David Lee Biskind from UCLA notes that straining on the toilet is a well-documented stroke trigger in adults over 60, especially those with undiagnosed vascular issues. Safer alternative: increase fiber intake with oats, flax seeds, greens, and stay hydrated to soften stools and ease passage. Bonus tip: consider a carotid artery ultrasound. Before starting any strength training, consider getting a carotid artery ultrasound, a quick, non-invasive scan that checks for plaque buildup or narrowing in the carotid arteries. Plaque buildup or narrowing is a significant stroke risk factor for adults over 60. Knowing your arterial health can help you make safer exercise choices and potentially save your life. Wrapping up, exercise is crucial for health, but remember to adapt and prioritize safety. For older adults, particularly those over 60 or with vascular issues, it's vital to approach exercise with care. Intense or poorly adapted workouts can pose a risk of stroke. Always consult a doctor to understand your individual health risks and safe exercise options. Prioritize controlled movement over high-intensity efforts and choose activities that support overall health without undue strain on the cardiovascular or cerebrovascular systems. By being mindful of our limitations and adapting our exercise routines accordingly, we can continue enjoying the numerous benefits of physical activity throughout our lives. If you found this information helpful, please share it with others who might benefit. Your support means everything to us. Stay healthy, stay informed, and keep moving in ways that feel good for your body.